Hello everyone, I hope you're feeling superb. So welcome to my medical virtual assistant learning journey. Today we are going to be exploring how an EMR system looks like, and we're going to be using Open EMR for that. So EMR system have like the same information inside. It's just that sometimes they differ with the way the dashboard looks like, but Open EMR has the same information. So what is an EMR system in anyone's language? An EMR system, which is an electronic medical record or an electronic health record, is a digital cabinet, like where patient information is stored. Like instead of using paper folders, you store everything electronically. So the common type of EMR that you have is Epic, Cairo, Practice Fusion, you have NextGen, you have eClinicals, Athena Health, Sana, but now it's called Oracle Health, and many more. So each organization or each hospital uses different types of EMR systems. So as long as you understand how to maneuver through the EMR system, the better, because you'll be able to work on another electronic medical record system. And this basically is, we're learning how healthcare team organize patient information digitally. That is what you're doing. So as someone who's learning medical virtual assistant on a daily basis, I understand knowing how to navigate an EMR system is an important skill, because many healthcare practices use electronic records to manage patient care. So before we start navigating, let's see how an EMR system looks like. So you're gonna go to your Google or any web browser that you use and type Open EMR demo, and it's gonna bring you something like this. Okay, so it's a demo. We're not using the real thing because of the HIPAA privacy. So we open, which is an open source electronic health record and medical practice management system. And the features that are inside this EMR is patient registration, appointments, medical records, and documentation. So the first thing we're gonna do is we're going to take this credential. You are an admin. Your username should be admin and your password should be pass. But when you're working with a real EMR system, you're going to be given the username and the password of the hospital you're working, or the clinic you're working with. So here we're going to use this username and this password. So we go. And then you can just choose any of these links. You just tap on any of these links. So you tap. It brings you somewhere like this. So the first thing when you open an EMR system, what you see is this. What do we call this? This is the login portal, like where you're going to be logging the login page. So each healthcare system requires secure access because patient information is private. Like you don't need to share it with anybody. So you're going to see the login screen, and then you now start logging in, and you're going to put the let's say admin, and the password is pass. I don't know if it's going to accept this because I've been on this website for long. So let's see. Yeah, it has agreed. So see. Okay, so let me just remove this. So we go to patient, we go to new, because we are putting on a new patient, but keep understanding that this is a fictional patient. This is not real patient information. So when you open where you're supposed to add your patient, you're going to see the title, the name, the preferred name, because there are patients that prefer a certain name. Like if your name is Samuel and you prefer a name Sam, that patient will prefer to be called in a name that their friends call them. I guess they feel more connected to you. So we have the sex, date of birth, and all that, marital status, and all that. So you see the ones highlighted on the red are the most critical ones, because if you mess up the date of birth and the name, when you're going to search the client, if they come for the next visit, you're not gonna find them, because when a client comes for the next visit, we input the date of birth and the name so that you can see the client that you're dealing with. Okay. So we're gonna first, okay, let's just see what else is entailed. We have, if they had a previous name, there are people who have names that were called earlier and then they change their name and all that. We have contacts, where you input the email address, where they're from, which county, their contact email, and all that. We have choices. We have employer, like we find that there are people who are under employee insurance coverage. So you're gonna come here and import the employer. We have the stats, we have the means, we have the related, and the insurance. So basically, these are the things that are always when you open an EMR system. So we're gonna start our fictional patient profile. So our patient is Mrs. Okay. And her first name, let's call her Sarah. Okay. Last name, let's call her Mila. Understand that the data we are using is not real data, is fictional. So Sarah is a female. Okay. And date of birth for Sarah, we can say June. Let's check 1993. So let's use this to just say June or July 9th. Let's just input that, the better. Okay. So we go ahead to drop down so that you can fill her contact information. We have her phone number. No, not her home, it's her real number. So that is what you're going to input. So we have 555, wait, 555, 5234. It's just, we're just guessing, so it's not something bad and all that. Okay. We also have her, she's given us her contact email. So we can just, I don't know why it's bringing my email. So we can just input Sarah dot Mila dot demo at gmail.com. Just understand it is fictional, so yeah. And there, yeah. So we done. Also inside the, I think we're done with the information. We don't have the rest of the information, so the rest of the information they'll tell you if they want to see Dr. Smith. You can just write I want to see Dr. Smith. If they were referred by who, you can just write they were referred by so and so. Have they received the HIPAA notice and all that, because these are the things that you're going to communicate to your client when they call, to the patient. Sorry for that, to the patient when they call. So let's first save so that you can create our new patient. We confirm. Yes, we want our patient on the system data. Okay. So in the patient profile, you have seen that we have seen them medical history, if they have any allergies or what and what. We have their reports, documentation, transactions that they have had. So let's do something else. We on the patient profile, let's add some allergies. The patient called saying that they have allergy, so you can add that they have allergy of what you type. Like you type what type of allergy they have. You're right, penicillin. So that is an allergy they have. So severity, you can take, like these are the things you ask a client. So when they tell you if they take penicillin, how is their severity? Is it moderate? Is it severe? And all that. What is their reaction? Do they get nausea? Do they get shortness of breath? Do they get hives? Let's just put nausea for this. And you write any additional comments. They can say when they this allergy of penicillin comes, they always, let's say get so hot and all that. So you start here and then you say you say when did it start? When did they notice having allergy for penicillin? And if it's something that is continuous, you leave it blank because it is still active, okay? And then you save that data. That is important because when the doctor is going to prescribe any dose of any medication, they're going to know that they're not going to give our patients Saramila anything with penicillin. So you have written there allergies. You see it's popping up. We want to write on the medication. You need to add that she's taking medication, or does she have any other medical problems and all that. So on medical problems, you can add that she has seasonal allergies. Okay. Okay, it's not there. The title is not there. So we can say she has seasonal allergies. Okay. When did it begin? You write the date that the allergies began, and then you save to ensure that everything is on the records. Okay, let's go back to the dashboard. We're going to look at medication. Right now, our patient is taking medication. Which medication is she taking? So our patient is taking medication. Which medication is she taking? We're going to add that. She's taking vitamin D supplements. Let's see. So vitamin D supplements, right? Let's say she began taking last month on date 1 at 9:30. She started taking and she's continuously taking. So you can also write the dosage that she's taking. Does she use it at home or that, or was she discharged with the medication? And what was the intent of the medication? Was it like it was assigned by the doctor or not? Like, does the source know that this client is taking the medication? Yes or no? Or if your patient is referred, the doctor will refer them know that they are taking the medication? Yes or no? And with that, we have our patient put in the system. Okay. So as you can see, when you go back to the dashboard, you can see every information that Sarah Miller has given us, the allergy, the medical problems, the medication, it's all in the system, okay? Or schedule an appointment. So we go to our calendar here, okay? We come, we find our, what do you call them? Our health facility. This is, let's say, Future Clinic. Future Clinic, we like, I want us to see the kind of, doctors we have. I don't know. Yes, okay. So we want to know, so this is Future Clinic, and we have, which doctor is this? Yeah. So this is Future Clinic, and we have Dr. Smith Bill is around to take our patient. So what are we going to do? We're going to check a calendar for, let's say, tomorrow. Tomorrow is date 18. How is the calendar for Dr. Bill Smith? Dr. Bill Smith doesn't have anything from 8 to 10. Let's say from 8 to 10. So we come at 10. There. We chose category. This is our new patient because Sarah Miller is a new patient, and it's a great clinic. That is the facility. It's also the billing facility where she's going to be. The patient is Mira Sarah, and the provider is, Smith Billy. And you're going to input the time. What time is she going to come? It's tomorrow. Tomorrow is 18th from 10. Because it's a new patient, we always love giving ample time so that the doctor can get to know who the patient they're talking to is, because this is a new patient. But if it's somebody who's coming for follow-up, 20 to 30 minutes, okay. But for a new patient, 45 minutes. So you're going to repeat that day, the day, like we don't need to put, it's okay. So you're going to assign the status. You can just, status is just to write a comment if the patient like read, or if she emailed to confirm and all that. You see, anything you need to explain is here. So let's just leave it at that for now. So room number, you're going to assign your patient a room number and all that. And you confirm, you say, the patient will be at the hospital, will be at the facility 5 minutes late. So the doctor will understand that this client will be a little bit late because the client told you they can't make at that, they say they can't make at that time because they have a sick child. So instead of canceling, they say, can you give me 5 minutes later? I will come. And you save. And you save the information. Just understand this is a demo account, so it's not so small. So you see, Mila Sarah is where? Mila Sarah is where? Is on the appointments show. Understand that scheduling is an important administrative task. Like as a medical virtual assistant, you're the one helping with, appointment coordination while ensuring that you are following privacy and workflow guidelines. So for today, we reach until there. At least you know how to put a new patient profile on your EMR system, how to maneuver an EMR system, and how to, do appointment scheduling. So that was our first practice session, which was navigating the Open EMR, and we have learned how to access the system, explore the dashboard, create patient profile, and understand basic workflow. So meet me in the next video where we will explore patient charts and medical documentation. And if you're also learning medical virtual assistant, follow along with me through this journey, because I believe every day is a learning journey. Let's meet next time where we're going to see how we import the SOPs into the system in case we want progress notes, in case you want lab results, how to put in the vitals and everything. So today was amazing. Let's catch up in the next video.